Good afternoon. Thank you for staying. I'm going to speak to you a little bit about innovation in the area of health, welfare, and biosecurity of our beef cattle. The health of our beef cattle are threatened by a number of factors, but I'm going to speak about these three this afternoon. Parasites are by far the most important, but we also have to deal with microbes or germs, bacteria and viruses, and toxins, amongst other things. Parasites are definitely cause the biggest impost to the health of our beef herd, and there is a variety of these. Cattle tick is at the top of the list, but we know about things like buffalo fly and internal parasites, and in some cases the vector-borne diseases. In other words, things like ticks can carry tick fever, things like mosquitoes and other insects can carry viruses like 3-day sickness, for example. And these parasites in combination were estimated in 2015 to cost our beef industry's health a cool $330 million. And on the slide there are just 3 examples of innovation, or prompts for me to tell you about a few innovations. I was called a number of months ago by a producer north of Brisbane who read about this buffalo fly trap that was developed by QDPI personnel with MLA funding, and he wanted to build one and there are actually 2 of them available. He wanted to know my opinion, and I said, I like this one, but I've actually never seen one in operation. Will he please let me know when he's built it? And he did. So in January I went and took this picture, and it's absolutely amazing. You have to train the animals to walk through this darkened tunnel because they don't like to do that intuitively. But they walk into the tunnel with a whole lot of buffalo flies sitting on them. The moment they are into the darkness, the flies take off and they head for this lit slit on the side of the tunnel. They get caught in a little fly cage on the outside and they die there because they don't know how to get out. So every time the animals walk through this tunnel, they lose a whole lot of buffalo fly. And I think that's just a very elegant way of reducing reliance on chemicals. We've been battling the chemical industry. I spent a lot of time working in the pharmaceutical industry, and we do not have chemicals today to which buffalo fly are not resistant. So if we can reduce our reliance on chemicals, I think it's a good way of going about it. The tick in the middle is an engorged female. She's spent the last 7 days or so on the host animal. She fell off that animal within, she engorged to that stage within the last 24 hours or so that she was on the animal. She's going to crawl around, look for a shady, sheltered spot, and produce around 20,000 eggs. That's the sort of thing that we deal with in the case of cattle, ticks on cattle. That is actually not a cattle tick. That's a bush tick, Haemaphysalis. That is the tick that transmits, or that's been shown to transmit in Australia, a parasite, a blood-borne parasite called Theileria. Now, in days gone past, you diagnose Theileria by taking a thin blood film and staining it with a stain called Giemsa and looking at it under a microscope at 1,000 times magnification, and then you got a picture like the one on the far left. What you see there, where the arrowhead is the multiplying stage of the Theileria parasite. Why is this important? We've had Theileria in cattle in Queensland for well over 100 years, we know that. But about 15 years or so ago, and that didn't cause any problem that we were aware of, but about 15 years or so ago, cattle on the eastern seaboard of New South Wales specifically started getting crook, and some of them died. And they were pale, and some of them started showing yellow jaundice. And when they were some of them died, as I said, and when you took a blood smear, you saw this parasite. But yeah, what was this? Because we've had this thing for a long time. And it took modern technology in the form of molecular biology to alert us to the fact that there has been an incursion of a new version or a new strain or a new subtype of this Theileria parasite. And so that was it's an example of an innovation on the diagnostic side using molecular biology. Otherwise, we would not have known that. In the case of the microbes, as I said earlier on, we deal with viruses and bacteria. Some of these diseases are contagious, in other words, they spread from animal to animal, and others need to have a vector to transfer them, whether it's a mosquito or a midge or a tick. And I guess the four most important ones that we have to deal with in beef cattle at this stage is pestivirus. I've enrolled for the pestivirus lecture tomorrow. I hope most of you have as well. There's always something new to learn. 3-day sickness is an enigma for us. There is a vaccine available, but the disease spreads north and south depending on the seasons and depending how active the midges are that transmit it. Botulism is, of course, not a bacterial disease. It's actually an intoxication, but it's a toxin which is produced by bacteria, and vibriosis has been with us for a long time. These 4 diseases in combination were estimated in 2015 to cost us $150 million. And there is innovation happening, especially in the area of vaccine improvements. The problem that we face in the northern beef industry is this thing of having one chance in a year to see these animals and to stick a needle in them and get them vaccinated. And most vaccines require a booster injection. If you start vaccinating an animal for the first time, you need to give a booster about six weeks later, and then you usually have to give an annual booster to maintain the immunity. It would be so much better if we had a vaccine in a formulation which means that one injection will do the job for the season. And work in that direction is happening as we speak. Our cattle face a number of poisons or toxins. Most of these are of plant origin, not only. There are mineral toxins, for example. We were blown away. We published a report in 2015 estimating the cost of endemic disease in Australian livestock. And monofluoroacetate did not even feature on that list. Just at the time when that project was published, we were finishing off a report to look at the impact of monofluoroacetate poisoning or Gidgee poisoning, and we were blown away to find that it was estimated to cost the industry $45 million a year. Now, there are a number of plants in Australia that contain monofluoroacetate, and it's not an easy thing to avoid. So one of the innovations that is currently nearing completion is to figure out a way in which we can manipulate the rumen microflora of animals that have no choice but to eat the plants that contain this toxin. There are naturally occurring bacteria that can detoxify fluoroacetate. And the project that we've got nearing completion is looking at a way in which those bacteria can be encouraged to make up a larger portion of the rumen microflora so that cattle can actually graze or browse in those areas. It's mostly browse. With impunity and not succumb to the poisoning. The pyrrolizidine alkaloids, PAs, is another group of important poisons for us. A whole lot of plants contain PAs. Think of lantana, think of St. John's wort, think of fireweed. These are things that cause liver damage and then make the animals photosensitive, so that the liver can no longer metabolize the chlorophyll in the green plants, and that is a photoactive substance. It makes starch in the plant, so it causes photosensitivity. We don't have an answer yet for PA poisoning, so that's some more work to be done. Pimelia is another one, and similarly to the detoxification efforts that we're putting into the fluoroacetate, we also have a project running to see if rumen microflora can be manipulated or trained to detoxify the Pimelia poison. I've got little time left, so I'm going to run through the welfare issue. Our focus with welfare at this stage is aimed at husbandry procedures, the things that we legitimately do to our livestock because we've learned over centuries that that's the way to do it. But increasingly, much of what we do with the livestock in our care causes outrage in the urban population that we're trying to feed. And the approach that we follow is this 3R philosophy. If we're trying to replace the things that we do with more humane methods. We're trying to reduce the amount of these inhumane methods or aversive procedures that we have. And if we can't do that, then the last thing that we try and do is to at least improve or refine the techniques. replacing aversive procedures. We've identified a gene with which you can select animals that are naturally polled, so you don't have to dehorn them. You know, microchip technology is far advanced. You know, we could, if we wanted to, microchip cattle instead of branding them, for example. Reducing the aversive procedures. In certain instances, we might get away with not actually castrating steers. We might be able to slaughter them before they become offensive in their behavior. We can flank spaying and dropped ovary technique in the spaying procedure of female cattle is a very confronting thing to think about. And so we have at least one project running and one in the wings to look at immunocontraception. In other words, giving animals a vaccine that'll render them infertile, and so that we don't have to do these aversive things to them that people in the street find really very confronting, and which frankly, if there are alternatives, we should use them. Then the last R, the refined one, is actually in the form of pain relief, and if there is a way in which we cannot avoid doing something painful to the animals, at least maybe we can try and relieve that pain and make it a less aversive procedure for them. Area of biosecurity, I'm going to run through this very quickly. Maintaining the biosecurity of an enterprise or a region or our country depends on being able to diagnose the threat, to prevent it from incurring or from entering the property, and if it manages to get in, to get rid of it as quickly as possible. In this area, there's been a lot of technical innovation in the area of diagnosis, moving from the things that you can visually see to molecular diagnosis, not only to identify the pathogen, but also to identify the host's or the animal's response to this infection, and where you are in the stage of infection and what the correct intervention would be. We run a series of surveillance activities to make sure that we keep our country free from the exotic diseases that we have. In a similar vein, the producer himself or herself should maintain surveillance on their properties to make sure that diseases that currently don't occur there continue to stay away. If you have an outbreak, then of course you contain it with vaccination as much as possible, and you're trying to prevent spread with quarantine measures and containment. And there are a lot of resources available on the web containing a lot of very useful information, such as the Farm Biosecurity Network that I have shown there. In the end, in the case of eradication, if you can't eradicate, then at least try and contain. I think all of us want to, as far as possible, avoid the psychological cost of funeral pyres like the ones you can see there that would happen or that have happened in the case of, for instance, a foot and mouth disease incursion. So the cost of eradication are high, both in terms of the economy and the psychological impact on the population. That's it. If we innovate in the area of health, welfare, and biosecurity, in the case of health, it's innovation that we engage to try and limit production loss and productivity loss. In the case of welfare, it's innovation aimed at maintaining market access, making sure that we keep producing red meat in a way that the person in the street finds acceptable and can live with comfortably. In the case of innovation in the areas of biosecurity, is to continue to maintain the well-being of our northern beef herd. Thank you very much.